First up today, the measles outbreak. The number of cases is climbing day by day, with thousands of people across the country contracting this disease. Now, disturbingly, the CDC is reporting more than 700 cases in South Carolina alone. If you can tell by my voice, that's where I'm from, so this hits close to home, right? In fact, South Carolina has more cases in the last 4 months than the entire country has had in the last 30 years. But regardless of where you live, one thing is common. About 94% of all the cases in the United States are among unvaccinated people. My first guest today is Dr. Neecy Hudson, founder and chief scientist with the Hood Medicine Initiative. Welcome, Dr. Hudson.
Thank you.
Yeah. You know, many people on social media describe the measles in the same way they describe chickenpox, right? Like it's just a rash. But is that true? What exactly is measles?
Well, I guess firstly, I'll say in terms of the broader picture, we as a country, we eradicated measles a long time ago. So the fact that you're even asking me about this is hugely frustrating. But we know why that is. But in terms of like the effects, firstly, I think it's wrong for people to look at it as something that they should just let their kids go through. Chickenpox is kind of like that, and of course, we all went through that, but it's just not necessary. And with measles, it can be a little bit more dangerous. I mean, it starts with like a fever, normal kind of flu-like symptoms. You have cough, runny nose, all that kind of thing. But then you start getting white spots, and it could be, they form inside your mouth, like after you start getting symptoms. And then the rash spreads typically to the rest of the body. And so most people just have, maybe some mild complications like diarrhea or pneumonia, things like that. But, it can lead to complications that include like blindness, seizures, brain inflammation. And we've obviously seen many kids perish because of the unwise choices of their parents recently. So I don't ever advocate ceding any ground that the human species has made over microbes. We've studied these diseases for decades for a reason, and it's simply ridiculous to not vaccinate against them.
And you mentioned, can you help explain to the audience? You said that we nearly eliminated measles. What does that mean? What did we do to get to that point? And why are we now at the point we have so many cases every week?
Not a shocker, but we vaccinated. That's how we eradicated measles. The thing about vaccines that we've talked about, ever since our inception at the beginning of the pandemic, it's honestly your body's way of getting the intel it needs on viruses and other pathogens that you might encounter. That's what's so important about vaccination is that, your immune system is essentially like a spy network where you have a headquarters where all of the data files and the dossiers on all the supervillains are. And when you, just like any Bond movie at the beginning, you meet this new supervillain and he starts wreaking havoc. And next thing you know, you're trying to find out, who is he? Where is he from? How do we kill him? That's essentially what your immune system is doing. And by taking vaccines, you're getting that intel before you even encounter that person. So it's extremely important, especially for things like COVID, like the measles, that can be deadly because if enough people within the population become vaccinated, then you have herd immunity, which is protective over everyone who's vulnerable or unvaccinated. So it becomes something essentially that contributes to community and public health. And since our world is so intermingled now as opposed to previous centuries, that means it impacts everyone globally.
your analogy of superhero, supervillain, because that's how public health, that's how we can get messaging out, because it makes sense when people hear it. And you spoke about the groups of people who are the most vulnerable. Who are those people that we should definitely say, hey, you need to get that measles, mumps, and rubella vaccine way back when? Who are those people?
So generally speaking, it's young children and infants. I'm sure we all know, because of our own experience, that you receive a schedule of vaccinations at specific times in your growth and development. And so young children who, are on a first round or haven't gotten everything that, an adult would be fully vaccinated against, they're vulnerable. Elderly populations, particularly those who, may not have been vaccinated for certain things themselves, but certainly just because of, natural sort of physiological challenges that develop as you age. There's certainly a vulnerable population. Immunocompromised people with immune deficiency, cancer, or other conditions that sort of leave them open, more vulnerable to infection, because for whatever reason, all of those signals, all of the messaging in their bodies doesn't make it to headquarters. And if it doesn't make it, then, the other thing that's, your immune headquarters is responsible for is deciding which assassins to send out, how we're going to mount a response to different threats, just like any spy organization would. But when you become compromised, that's difficult to do. So they're certainly vulnerable. And I guess I would also say, because of the policy shifts of this administration that has deliberately dismantled vital public health protections, a lot of the people who are also impacted are poor people at this point, people who've had their Medicaid cut, people who are going to be impacted by all of the inane and erroneous, measures that RFK is putting in place that disrupts the way that we regulate vaccine schedules in this country. And so by doing that, that means, potentially schools are going to, not be able to maintain the same level of protection for students. Eventually, we have, when you change all those recommendations, that also means that changes what health insurers are obligated to cover. Mm-hmm. So all of this anti-vax propaganda is purposeful, it's deliberate, and it's meant to disenfranchise millions of people from access to vaccine protection. And what we need to ask ourselves in these dark times is why.
That is absolutely the question I have. You mentioned the HHS Secretary Robert F. Kennedy Jr. I don't know if you saw the quote from Dr. Kirk Millian, who is the pediatric cardiologist and acting chair of the advisory committee on immunization practices. And he's quoted as saying, and I quote, "What we're going to have is a real world experience of when unvaccinated people get measles. What is the new incidence of hospitalization and what's the incidence of death?" And that was his rationale as to why we shouldn't necessarily have to blanket vaccinate everyone, that we needed to see in real time what can measles do today as compared to 30 years ago. How does this concern you?
Well, first of all, it's a very Nazi-coded way of looking at public health, because eugenics is tucked into that. The point of that thinking, the arc of that thinking is, we don't need to protect everyone. Let's let natural selection take care of that, which I think is hugely rich and ironic, considering they have restricted breeding in our species for the last half millennia. But that's part of that ideology, sort of. There's always an inherent element of sort of population culling and starting with the undesirables. And honestly, it's not just in the public health sphere. If you look at the way that they've disrupted regulatory agencies like the EPA and the USDA, the CDC, how we've withdrawn from WHO. All of these things have implications that that make us less safe as a populace. And that is what we look to our government to do. But with this particular administration, firstly, they started, and are continuing to erode institutional trust between the propaganda, between the measures that they're taking. When you think about measles itself, the spread of measles that we're seeing in the U.S. is solely attributable to RFK himself. But what's crazy about it is that not only is his propaganda and impacted policy, which has made more people susceptible to measles, but his misinformation propaganda has also made it so that there's been a 39% increase in vitamin A toxicity because he's been promoting it as an unscientific alternative to measles vaccination. That's insane to me. I don't know what's happening right now. But in terms of like all of those culminating effects, you have that impact on vulnerable populations. You have a resurgence of disease, and I'm sure measles isn't going to be the only one. If you want to get funny about it, COVID is resurging, but nobody seems to care anymore. Along with other diseases have been eradicated. We've seen the plague, we've seen polio. All of these things that people should not have to even think about anymore are coming back. And a lot of the background moves that he and Doge made in terms of workforce collapse and for the HHS, in terms of research stagnation, particularly targeting mRNA vaccine development, which is critical for the bird flus we're getting ready to anticipate, for HIV treatment developments, and just even for cancer treatments. We use RNA virus technology for all kinds of things. And so they're just really latching onto this and using this as a mantle to, I don't know, ask yourself what their end goal is, because right now it just seems like a lot of people are getting sick and perishing.
Right. On a closing note, you brought up a key point of like, why are we having so much vitamin A toxicity? And I think it's because those persons, those anti-vaxxers, the RFK Juniors of the world, they have the loudest platform. And so parents don't know what to trust. So if you had a moment to speak to the parents that are listening to this show, what are the important vaccinations that you recommend the parents get for their children before they enter into elementary school? And if they haven't had it so far, to get it today?
I am so glad you asked. I mean, certainly even though, he is doing all of these things and there's all these new sort of recommendations that are being put forth, a lot of the, physician bodies like the AMA and others are still recommending that we go by everything previous to this administration in terms of vaccine schedules. So what we've all had to get into school, measles, mumps, rubella, now, chicken pox, diphtheria, tetanus, all of those things that are on the school list. And then now that we're smack dab in the middle of flu season, as it were, obviously there's always the annual flu vaccine, RSV, the updated COVID vaccine, which I would say people should definitely get because there are new variants circulating from before. And then just as a note for older Americans as well, the pneumococcal vaccine, shingles, of course, if you're 50 or older, and certainly getting that RSV is something that I think would be important for those populations as well.
That's incredible advice. And for those who need a little extra incentive on the shingles vaccine, it's actually been shown to be helpful for those with Alzheimer's disease and slowing down the process of them losing their memory. So let that be that drives you to get your vaccination. So thank you, Dr. Hudson, for joining us. You have been so informative on things that literally can impact whether or not these children and adults live or die. So thank you.